So basically what you want to do during the treatment is, well, I'll let you go and start treating, and I'll just talk to you about it. But basically, you want to have just a little bit of overlap, so you don't miss any of the areas.
Okay.
Yeah. Okay.
And if you have patients that come in, it gets them like, if it gets a little bit blotchy for them, it's going to subside. It always does. It's if there's just like a little bit of post-treatment erythema, don't worry about it.
What about the actual treatment? How long does this take?
It depends, yeah.
30, 45 minutes. Oh, really?
Yeah, if you could go pretty fast, you'll see how fast it goes. Like once you get going with it, the thing is that you'll find with this is you have to have contact with areas, like full contact with areas. The system doesn't fire unless the skin is actually it's compressed in there.
He's ready.
So in areas like in Javier's thin, he's got around his forehead's kind of bony. You'll notice it might take a little extra time to get it all set up.
You have good bone structure, have you? You know who else you remind me of sometimes? Toño. ¿Verdad? The high cheekbones.
Okay, once you're green, you'll just move that around, and sometimes you kind of gotta. Yep. You know what I would do is I'd start on his cheeks, so you get yourself used to it. Okay. So when you see this, you want to just do a little bit better job with overlapping. So maybe just kind of go right in there.
What does it feel like, Javier?
Like warm.
Okay. So it's not like hot.
Like
it's not
it sucks, and then it's like really warm.
So it's not like an uncomfortable.
No, you know what? In most of us, like adults, are fine with it. You're going to get kids that come in because that's probably a lot of your patients, and they're going to complain about it. And you just got to tell them it's mildly uncomfortable, but this is what we're doing to treat your acne. So you have to I've had these in offices, and they say, well, everyone complains about it, but they're kids. They're adolescents, they're teenagers, so it's not super
comfortable. They complain about everything.
Right, they complain about everything. So what would they rather have? Just a little bit of uncomfortable, have it a little bit uncomfortable when they're getting treated, or keep on dealing with
that? Or a lifetime of the acne. Yeah.
Right, yeah. So it's like I did one of these things at a derm office, and they're like, well, everyone's complaining. They said it's really hot. I'm like,
really?
No, it's not like. It's not like a walk in the park or something.
Well, everything is going to take some effort on your part.
Yeah. So, I mean, this is a very sophisticated piece of equipment. It's proven efficacy. We know this is going to work.
Yeah.
You have to follow the settings though. And what she was doing is she was turning the settings way down. She's like, well, I wasn't getting any reaction. I wasn't getting any results. I'm like, what are you doing? Where are your treatment settings? She's like, well, everyone was saying it was hot, so I had to turn it down. So. Like,
how are you going to get
you're fighting.
Yeah.
You're not going about this the right way. Yeah.
Yeah. Just so when you're not around.
No, it's good. I mean, And I'm going to leave you, Aaron. I'm going to leave you Bob Anderson's cell phone number. He's the owner of the Therabond company. So if you have questions while you're doing treatments, just call Bob.
You okay? So does it have like a UV ray or something?
It uses a 500 wavelength.
Oh wait, you
yeah.
tell me that.
Javier, if you gave us a 1 to 10, like 10 being very very painful, 1 being nothing at all, where would you say you're at?
3.
3? Oh.
Okay. Good.
She'll see.